because you can see the patient and you're there with them and we can't, there's a bit of limitation, obviously, with these patient case presentations, but you can help us. What was her seemingly the most important issue for her? She's got all these different areas where she's bothered with some neck and elbow and wrist and hand and chest and all. Did you prioritize with her help as to what's your primary concern? What's most important that we address? Not that we won't address everything, but what's primary and what did you learn?
For her, of course, was the fingers, the thumb and the index finger. When you try to pull it in, she couldn't separate the two. But again, in the hand, you cannot get to a true diagnosis till you clear the spine, till you clear the wrist. And unless those are ruled out first, you're going to have muddy waters. And so she was very agreeable to looking up the chain because of, any time you have a string instrument, upper strings are notorious for having cervical thoracic components. Typical. And I've seen frequently individuals who come in with just purely wrist or hand symptoms that abolish with cervical spine movements. And so those have to be cleared before you proceed forward, just because you don't really know what's there until you take a look. But again, it's really about the hand. It's all about the hand of that.
Month after month, new guest experts sharing actual patient cases and subscribers sharing their own challenging and interesting cases. Check out Case Conversations at mechanicalcareforum.com.